guys, what's going on? It's Dr. Ganatra, author of Reinventing Dentistry and founder of Dental Practice Mastery, where we teach you how to build, market, and grow your practice. So in this video, I want to talk to you about what do you do or what do you say when a patient approaches you and says, wow, doc, this is so expensive. So we've all gotten that before. That's the response that many patients may have to dental work, because as we know, dental work can add up and it does get costly, right? So, I'm very comfortable with thinking that it does get expensive. Dental work does get expensive. But when a patient holds that sentiment of like, wow, this procedure is so expensive, what do you do? How do you approach that? How do you respond to that? And how do you make it so that their approach is not coming from a place of, wow, this is so expensive? So here's what we've learned after 13 years and a few offices and thousands of patients, and really getting our case acceptance up to 90-95% case acceptance with most of our patients accepting treatment. This is what we've learned. Most doctors, most dentists try to build value, okay? And when you're building value, it's great. Education is one of the biggest ways you can build that value, right? We're taught in dental school that, educate your patients, show them what a prophy is, tell them exactly what a crown is, tell them why they're getting this crown over that crown, why they're getting the white filling over the silver filling, why do they need a night guard? Educate them on all these things, and then you're gonna build this value on that procedure. And if you build enough value, your patients are going to accept treatment. Well, guess what? That's necessarily, you may know it, necessarily that is not usually always the case, right? If you build enough value, people don't always say yes to treatment. They don't always accept treatment. And there's a reason for it, And the biggest reason for people not accepting treatment, when you're just building value with your patients, you're building that value, you're building that value, you're building the value, and you're telling them everything they need to know about that procedure. You built so much value, but they're still not accepting. You know why? It's because you haven't given them perspective before value. Okay, so this is a key distinction I want you to take home here today. Perspective before value. You have to give them perspective before value. So what does that mean? I'll give you one of the best examples. When Steve Jobs came out with the iPod, what was the tagline? It was, wow, it wasn't this iPod can, play a ton of songs. It wasn't that you can store so many songs in the iPod, which was really awesome. It wasn't that, hey, you can have a huge music library in this iPod. The tagline, the marketing line for that iPod was essentially 10,000 songs in your pocket, right? 10,000 songs in your pocket. That right there, that gives you a whole different level of perspective, right? Same thing with clinical dentistry, same thing with treatment planning, same thing with having patients accept treatment. I'll give you an example. Let's say you are doing let's say you're doing a crown on a patient, okay? They need a zirconia crown, a porcelain crown, and let's say their insurance only covers the PFM. Okay, covers the PFM, and they have other PFMs in their mouth, but you're recommending the zirconia crown, the metal-free zirconia crown. So how do you approach that? If the patient says it's so expensive, what's a good way to kind of not only build a value, but also give them the perspective? You have to give them perspective before value, right? So the best way to do it is you look at their other teeth, and let's say they have some other crowns in there. Let's say they have some PFMs, and you can see the dark line around them. And most patients, if they have some PFMs, you will see dark lines around them. You will see that from a color standpoint, from an aesthetic standpoint, they're not going to be as visually appealing as the all porcelains or the zirconias. That's a whole other clinical subset right there. Let's not tangent into that, but look into their mouth and then look at some of the other teeth and say, hey, look, you see this crown here? This is not a zirconia crown. It's not an all porcelain crown. And do you see the dark line around the tooth? That's because it's, has metal underneath it. And do you see this natural tooth over here? You see how this natural tooth, and you show them in the mouth, you see how the natural tooth looks nice and vibrant, and it's translucent, the color shines off of it really well. That's a natural tooth. When we build this zirconia crown, when we build the all porcelain crown, the metal-free crown, then we're going to get that vibrancy, that nice color effect, that natural effect with this tooth. Not only are we going to get that, not only are we going to get that, but we're also going to get a strength that comes from chewing. And how long have you had this other crown in there for? Oh, they'll say like 10, 15 years. Well, yeah, that's great. You've had it, and you have some wear on the crown. And do you find that you're using it every day? And patients will say, yes, of course they're using their crowns every day. But you have to kind of get them to see that, this is something you use every day, and it's something that you function with all the time. And not only that, this crown here is deteriorated, where the zirconia crown is the upkeep and the future quality of that crown is going to be much more, effective at being bacteriostatic, much more effective at, fracture resistant, all that stuff. So you have to give them perspective before value. I'll give you another example. Let's just talk about like deep cleanings. So if a patient needs a deep cleaning, when you're going through the x-rays, you may notice some tartar in there, and you may notice some bone loss, and you can kind of point that out to them. Hey, you got some bone loss here. Hey, John, you got some bone loss over here. You got some tartar over here. Do you notice how the bone is kind of slanting? The ridge of the bone is not really, over here. It's maybe the height of the bone is down below, more near the roots. It's slanting, and that can cause, when you lose the supporting structures of the teeth, that can cause a little bit of mobility. Normally when that happens, here's the catch. Here's the specific distinction you want to take home. Normally when that happens, we have to go in there and graft some bone in those areas. We have to add bone, graft it, and that's a pretty, costly procedure. It takes a little bit of time. There's a little bit of pain involved. Well, at this point, right now, we can address this by going underneath there and cleaning it out. If we clean it out, it's going to be a lot more effective. It's going to be a shorter treatment period. It costs a lot less, and we're going to be hopefully getting that periodontal disease or that gum disease at a point where we can manage it, right? So when you tell patients that you start off with something that could be, and now it's not gone that far, it's kind of like where this is the worst case scenario, but look, we can kind of tailor that down if we take action now, if we clean things up now. So this is what could be, and if you kind of initiate treatment now, we can do it more effectively with less cost and with less treatment time. So we've given them that perspective of that treatment, right? And then we build the value. What do we do in a deep cleaning? We use an ultrasonic. We go underneath the gum line. If you have a space in your gums that's 2 to 3 millimeters, and that may be considered healthy. If it goes down to 4, 5, 6, 7 millimeters, that periodontal or that gum disease process continues. And your toothbrush can't really reach below 1 to 2 millimeters, right? That gives them some more perspective. This is a perspective on what my toothbrush can get down to. Okay, I get that. And that my toothbrush doesn't get down more than 1 to 2 millimeters. So nothing is cleaning that 4 or 5 millimeters of depth. So that gives them perspective, rather than just saying, you have periodontal disease, you have pockets in your gums, you need to get a deep cleaning done. In a deep cleaning, we use the best instruments, we use the best medicaments, we go in there with the best scalers. Those are all kind of features. They're not really benefits, and it's really not building perspective, right? So remember, build perspective before value. I'll give you another example. So when we always hear about, outside of dentistry, you always hear about how something big is. They may say it's 5 football fields wide, or 10 football fields long, or it's an arm's length. The wingspan of a bird is maybe a whole arm's length wide. So that gives patients or people a perspective on how long or wide something is, right? But it gives you a perspective on things. So use common world examples to give people a perspective before you build the value. So if you're treatment planning a patient and they're not really accepting treatment, ask yourself, have I given them perspective before value? I did the wingspan with the arm's length. We talked about the football field. That gives them a perspective of length or size. Obviously, you can't use that with a patient because those sizes may not apply, right? So let's give you another example. Let's say a bone graft. Let's say you're doing an extraction and it requires a bone graft. And sometimes the patient will opt out of getting the bone graft done. Well, what could you suggest? Obviously we all know that there's going to be less bone resorption after a graft than if you didn't have a graft. The studies all prove it, the articles all prove it, right? So if you are extracting a tooth and you want to encourage that patient to really consider the graft, the best way to go about it is to show them their x-ray and show them the bone around their teeth. You see, here's all your supporting structures of the teeth, and here's the bone around that tooth. When I extract this tooth, see all that bone around this tooth? That bone's going to be all disintegrated. And I put a visual kind of, like a visual in their mind. I always tell them, hey, you know, have you ever dipped an Alka-Seltzer in water? You see how it kind of fizzes away. The same thing happens to the bone. When you pull a tooth, it kind of resorbs. It gives them some perspective. Oh, okay, they got that visual of that resorption. It resorbs. If I add bone into it, if I add some bone into that pocket or that socket, that space after we pull it, then you're gonna have less resorption. It's gonna be more dense as it heals. You're likely gonna get a chance to put an implant in there, so it gives them perspective. Give your patients perspective before you build the value. So how do you build a value? You can educate them on the type of bone you put in there. You can educate them on how you extract the tooth. You can educate them on, you know, some post-operative things you can do. So all that stuff builds value, but if you don't give them perspective before value, then they're not gonna as effectively make that decision to say yes to treatment. You know, let's pick another example. Let's talk about fillings, okay? Let's say you're replacing a white composite filling into the tooth. One way to do it is if a patient thinks, oh my God, this is so expensive. Well, yeah, we know fillings can get pretty costly, but how do you build perspective before value? Well, one way to do it is talk about maybe they have some other fillings in there. Maybe they have some silver fillings. Maybe you can kind of give them an indication that this silver filling, it's 50% Hg mercury, it's 25% silver, and then it's 25% mix of metals. So it's a good amount of that silver filling is mercury, and then the other 25% is silver, and then the other 25% is a mix of metals. Do you see how the silver filling here is also kind of leaching around the tooth, making the tooth a little bit gray as well? Well, look at this natural tooth. And you just point out another natural tooth. See how it doesn't have that? So nowadays, when we place these fillings in there, we don't use mercury in our fillings. We don't have that element in there. It's been known to cause a lot of concerns and safety and safety concerns, and also a lot of health concerns. There's a lot of articles on it. I know there's controversy on both ends. I totally get that. But for the sake of this video, think about how you're building perspective. You're showing the patient what they got, and you're kind of taking them on a kind of journey to have them see what they're gonna get, which is the white filling, maybe a zirconia-based filling, maybe any sort of restoration that's metal-free, right? I'm using that as an example here, not to have you hang on to the clinical parts of it. If I was off on something, don't hang on to that. Pick up the example of perspective before value, right? So the way you give perspective is to have that patient look, have that patient see what's currently going on. That gives them the perspective of where they're at and how this actual thing looks and where you want to take them. Where you want to take them, right? I want to take you here. This is what you're going to have. And look at this tooth that's healthy. You see how it looks great? There's no crack lines on it. It looks healthy. It looks intact. That's what this type of restoration can do for your tooth. So that's another great example. Let's talk about another thing. Perhaps maybe you're thinking about, placing an implant in there, Well, implants can get pretty costly. How do you build perspective before value on that, Well, we can talk about how strong the bone is and how an implant actually anchors right to the bone. And it's the best way to kind of place a tooth in your jaw that's super strong and is gonna be really long-term because it actually fuses right to the bone. We're not talking about what type of implant it is. We're not talking about, how the implant is very specific for this area of the jaw. We're talking about this is the perspective that they need to have. Wow, this is fuses to my bone. It's very long term. These are all benefits. They're not features. Remember, we want to focus on benefits, not features. Build perspective before value. Another thing that we can talk about is how that implant, once it's in there, it's usually pretty good for a lifetime, right? Usually is pretty good. We can also talk about how there is no nerve endings in the bone. So just like your teeth are embedded in your bone, the implant will be embedded in the bone and there's no nerve in there. So it's a very painless procedure because you're gonna be numb and the implant's gonna go right in the bone. They may ask, hey, you know what? Is it painful to get one of these done? Well, I always suggest, do you cut your nails? Your nails don't have any nerve endings. Your bone doesn't have any nerve endings. We do numb you up because that area can be sensitive, but the bone itself, you're not going to be feeling anything there, right? So build perspective before building value. If you do that with all of your cases, I use a regular handheld, like a regular mirror like this, and I show our patients, you know what, this is what's going on here. This is what's going on periodontally. This is where you have a lot of the buildup. This is what's going on with this filling. This is where it's cracked. Have you noticed why, if something is getting into the crack of the tooth, just kind of like when you have a crack in your windshield. When it cracks, we don't know where that windshield is going to crack to. Or when you have a crack in a floor, stuff gets into that crack. Oh, they got an idea of what happens. And I'm always asking questions. I'm always suggesting, hey, did you have any food that gets in between those teeth there? Do you have any pain when you chew on that tooth? I'm always asking questions so that way I can find a deeper way to layer up the perspective of what they're getting done, right? Ask questions, and in asking those questions, you're layering perspective into everything, right? So when you say, hey, do you get food caught in between the teeth? I think I do. Oh, that's probably why your gums are a little bit red. So, that's why they're bleeding. Well, yeah, it's similar to a scab on your skin. When your gums get red, they're irritated, kind of like they're scabbing, and it's like an irritant on your skin, and it's constantly bleeding, and that's not healthy to have that type of long-term inflammation in your body, right? So we go over that, and it gives them the perspective of, oh, this is what's happening with the food. When we place the restoration in there, or when we place the crown in there, John, then you'll see that the gums are going to get healthier, and it's not going to bleed because that's not what should be happening. Kind of like this side. See how it's healthy? When you floss, it's not bleeding. It's clean. It doesn't get stuff caught in there, and the gums look pink, not red. Gives them perspective. Then I say, when we put the restoration in, it's a healthy, bio-friendly material. Perspective before value. Don't focus so much on building value, educating the patient. It's great to educate them, but remember, if you give them that perspective, then you can educate them in a comfortable way. You don't have to throw a ton of information at them. So I hope this video helped. Next time you do a treatment plan, just think about, I got to build perspective before value. I think I've driven that point home. Remember that one example I gave you earlier on with Steve Jobs, the iPod. It was 10,000 songs in your pocket, right? It wasn't all the tech stuff or the gigabytes of memories. It wasn't any of that, right? So same thing with us. What's the perspective you can give that patient about what you're doing that's going to actually build value? And if you're using something like CAD/CAM, that's a great way to give them that perspective. 3D printing. So kind of forgot about that one, added that one in there. 3D printing is something people know about. CAD/CAM is very similar to that, right? Cerac, all that stuff. So if you build that perspective before you build value, you will see that more of your patients are going to accept treatment and really see why that dentistry costs what it does cost, and really feel comfortable with it because you know what? They have the right perspective. So I'll see you in the next video. I hope this helped, and thanks for watching.